Hello, Temple. Thank you for joining us, for joining the Wellness Resource Center and Student Health Services to discuss facts about birth control. My name is Kate Pavlicek, and I'm the Sexual Health Program Assistant at the Wellness Resource Center. We also have Rebecca and Amber from Student Health Services with us here to help dive into this discussion on the different birth control choices available to students. Would you like to introduce yourselves?
Absolutely. So my name is Rebecca Keach. I use she and her pronouns, and I'm a nurse practitioner at Student Health. And I'm really excited about this topic. I do feel that contraception and family planning are, empowering. They allow people to make choices about their bodies and their futures. And really, this allows us to battle the gender wage inequality that is in our society. So I'm excited to talk about this today. Thank you, Kate.
Hi, my name is Amber Silverman. I'm one of the nurses at Student Health. I use she, her pronouns. This topic is really important to me because I believe it's essential for all of us to understand our bodies, know our boundaries, and build a strong sense of self-respect. Feeling healthy and confident and supported also starts with education. And that's something that we're super passionate about here. I also want students to know that Student Health is a safe space for open, honest conversations, even the tough ones.
Awesome. I'm very excited to have your expertise here during this important conversation about birth control and sexual health and, addressing some of those maybe misconceptions that are out there. So let's start by talking about student health services and how you all serve Temple students. Can you tell us more about the sexual health services that are available to students?
Absolutely. So at Student Health, we do offer STI screening, either through your insurance or at a low cost. And you can meet with one of our nurses. This is a quick visit, usually about 10-15 minutes. This is for people who are having no symptoms of STDs and they haven't had an exposure. If you want more information, you want to meet with a provider, you are having symptoms or other concerns, then you'll meet with one of our providers. We also offer PrEP, which is the HIV prevention medication. Right now, we offer the oral pills. We also can help you get connected to organizations who are doing the injections. We also offer PEP, and that's post-exposure prophylaxis. Essentially, if you have had penetrative sex, so vaginal or anal, within the last 72 hours, there wasn't a condom used or the condom broke, and you don't know the HIV status of your partner, please come in as soon as possible so we can chat with you about PEP and other options to make sure that you are okay and you're healthy. For birth control, we do offer all the birth control options. We do not insert IUDs ourselves, but that's our 2026 plan. So we're super excited about that. If you come in and you want an IUD, we can tell you about how that process looks. We can tell you how to advocate for, the most pain-free as we can. And we can talk you through like what are good providers in our area that we trust to do that work. And so those are kind of, the main points we see patients with and without insurance. If there is cost, we will be transparent about pricing and talk you through how we can best get you connected to what you need with the insurance you have.
Yeah, and we also offer a wide range of resources to make sure that you feel informed, empowered, and cared for. You'll find 6 condom dispensers throughout our office. There's one right in the lobby, and the rest are in every bathroom if it needs to be a bit more discreet. We also provide free lube, internal condoms, latex-free condoms, and Plan B for $8 or less. Pretty sure it's about $60 at CVS. So please come to us if you're not sure. Birth control is also available too, like Rebecca said, just requires a quick appointment. And if you're having menstrual cramps or headaches or anything associated with your cycle, we do have a self-serve area right in the lobby. It's stocked with free Tylenol and ibuprofen. And in every bathroom, we also have pads and tampons. Everything we offer is completely confidential and very affordable.
That is great to know, and I'm excited to dive more into those different birth control methods in this discussion. But I want to start off also by asking, and saying that we know many different students who come to Temple have different experiences with sexual education and access to sexual health care. Can we talk a little bit about why it's important for all college students to receive comprehensive sexual education and access to care?
Yeah, so I did some research when I was reading this question because I think we do all feel that less sexual education is available in schools. And I wanted to know if that thought was correct. And I did find out that only 49% of high school students in the US have some formal sex education. And of that, only 37% of states require that this education is medically accurate. I think that really plays into this theme of misinformation that we're seeing. So in my opinion, like young adults, this is the time for exploration, for taking risk. And it's unfortunate that this could have lifelong, impacts. And so we really want to be able to have students come to us, be able to, ask questions that maybe they haven't had the space to ask before, and allow us to dive in and give them the education that they can make an informed decision with their partners and with themselves.
Great to know. And then knowing that we've all received different levels of comprehensive sexual education in the past, can we start off this conversation with a little bit of like a 101 about the mechanics of reproduction, menstruation, and ovulation?
Absolutely. So I wrote out a little blurb, then I was like, a visual might be helpful here. So I do have a video that's really quick. It's less than a minute that kind of goes through these basics.
Sounds great.
The menstrual cycle begins with menstruation. Once the bleeding stops, the uterine lining becomes thicker and begins to prepare for the possibility of a pregnancy. Somewhere around day 14, an egg is released from one of the ovaries and begins its journey down the fallopian tubes to the uterus. If sperm are present in the fallopian tube, fertilization can occur. If the egg is not fertilized, the egg breaks down, and hormonal changes signal the uterus to prepare to shed its lining, bringing us back to day 1 of the menstrual cycle. Please watch my next video if
I will stop sharing. Stop share. There we go. Okay. So hopefully that is a good foundation for our future conversations. Yeah, I think that kind of the only thing I would add is just that sperm can live in the reproductive tract for up to 5 days. And the egg does survive about 24 hours after release. And so this is considered like the fertile window. And that's the time when pregnancy is most likely to occur. And again, any additional questions, we're happy to talk through it at Student Health. We have lovely models to do a similar demonstration in person.
Yeah. One question I want to ask is it common for fertilization to occur outside of that fertile window? Is that something that, people would need to be concerned about?
Yeah, I think that so the fertile window is set. Ovulation is typically, like I said, about roughly 14 days after the menstrual cycle begins. But that is a estimate. That's not anything that is hard and fast rule. And so I think when we talk about some of the non-hormonal options, we'll talk about like fertility tracking and how effective that is. And especially young people, hormones are not necessarily stable and consistent. And so, where that ovulation time period is can really drift depending on what's going on in someone's life, whether that's stress, taking antibiotics, you took a plan B. There's a lot of factors that can cause that to kind of shift. And so it's important to understand how the mechanics work, but it's not always the whole picture in terms of fertility. Is that helpful?
That is helpful. Yeah, thank you.
Of course.
Before we get into different types of birth control, can you speak to different reasons why students may use to begin birth control or use it?
So when I talk to any patient about anything, I always think about my thoughts and my bias. So I definitely come into the conversation thinking of, if I was sitting in front of me, what would I want a provider to kind of talk me through when making this decision. I have chosen to be on birth control for most of my adult life. And a lot of that is because I don't want to rely on someone else to decide when and how I get pregnant. I know that parenting, when I'm not ready, could impact my lifestyle, my ability to go out, my ability to travel. It also can impact my career, and on my overall like health and well-being, and the health and well-being of my kiddo. So personally, I love having a regular period, and I like to be able to skip it if I don't want. So that's my own perspective on it. I think when students are considering what they want, I think their intention of pregnancy or no pregnancy, their thoughts around their bleeding cycle, their relationship to their partner, thoughts around what they can do in this moment of time, are really, really important. And also thinking about what decision they would make if they were pregnant, and how that decision would feel for them.
Yeah, sounds.
Yeah. I do think that people choose to start birth control for many different reasons. To piggyback off of what you were saying, obviously preventing pregnancy. Some people need to regulate their periods. It helps manage your cramps, acne, or sometimes it's just simply to feel more in control of your body and your choice. So it's really about having options and making informed decisions, and also knowing that your health and future is in your own hands. And I do think that that kind of autonomy is super powerful.
Makes a lot of sense. So let's start by talking about non-hormonal birth control. What is it? What kind of options are offered, and how do they work?
I'm gonna try and do a quick share screen. This is from a organization called Bedsider. So this is from bedsider.org. It's wonderful, and essentially what I did was choose to have non-hormonal options up here. And so I'll just briefly kind of go through a few of these, and then I will talk about some efficacy, especially the ones that I know students at Temple are using regularly. So there is the copper IUD. Again, not something that we offer here at Student Health, but we can help refer. The main downside is just that there can be up to a year of heavier bleeding and cramping. And so we always like to do a good amount of education to come up with a plan to make sure if that happens, that you are still feeling like that is the right option for you. There is a cervical cap, internal condoms, fertility awareness methods, and this is really having a flow app, or specifically, there are now like fertility apps where they have you taking your temperature every day and putting that data in. There's sterilization, so this would be either a vasectomy or tubal ligation. The not right now is abstinence. There are condoms, diaphragms that I think were more popular when I was entering into my teenage years, less so now, because they usually have to be fitted. There are a few different sizes. Spermicide in gel, and then one of our most popular methods, which is the withdrawal method. And so just to clarify, that withdrawal method is the partner pulling out, so removing his penis prior to ejaculation. One thing I say every time I'm asking students what methods they're currently using is to understand what knowledge they come in with. And so withdrawal method is 80% effective. Usually that's more than people think, so it's more effective, but it still means 1 in 5 patients or individuals will become pregnant on that method, and that's each time is a different 1 in 5. For condoms, typical use is about 87% effective. And for fertility tracking, there's a lot of different apps, but they put it 77 to 98%. And part of this also is going to be whether someone has regular bleeding and really does, have the ability to narrow down that ovulation window.
That's very interesting to know and good to know about those different non-hormonal methods. I guess like why would somebody maybe choose to do a non-hormonal birth control method over a hormonal one? Is that something you can speak to?
Yeah, so I think that people are scared of hormones and the short-term and long-term impacts of them on their bodies. I think there is some information overload, whether that's from relatives or friends or social media, which I know we'll talk about a little bit later. I encourage people who do use non-hormonal options, and this is outside of the IUDs, right? So the IUD is incredibly effective. But the options that are, under 90% effective is potentially using more than one, right? So if you do have regular bleeding, maybe you choose to use a fertility app and you use withdrawal. But during the period of time that you are close to that ovulation window, you decide to use condoms. It's still not the most effective, but I think we really want to do a harm reduction approach here at Student Health and meet you where you're at. If you aren't comfortable with a hormonal option, what else can we do? The other thing is that any patient who's not on a long-acting reversible contraception, I offer a Plan B prescription with 5 refills. And this is because I want people to be able to troubleshoot their risk for pregnancy on their own. So we provide information. So they're like, oh, shoot, I did have unprotected sex close to my ovulation window. I'm going to take it. Or the condom broke. So I think, building a toolkit for students to be able to choose what's right for them is the most important.
Good to know. So now let's get into hormonal birth control. And then again, how does that work? What different options are there for the hormonal birth control?
And I am just going to share my screen. You're going to see a little bit of our notes, but I still think it's important. Actually, there we go. So I'm going to share my screen again. And this is from the same organization, Bedsider. And this kind of goes through the hormonal options. So you have the IUD, which we're talking about progesterone IUDs that can be good for 8 years down to the smaller ones, which might be 3 or 4 years. We, again, don't do IUDs here, but hopefully soon. We also offer Nexplanon. We are placing them and removing them here at Student Health, and we're getting all the providers trained so we can do this for as many people as who want it. And the implant is wonderful. It's the most effective option. It does have a risk of changing your bleeding cycle. And so having a conversation of how you might feel about that is really important. And again, coming up with a plan if you do have more bleeding than you want, what can we do to help that be reduced? The birth control shot, this is also just progesterone. This is going to be an injection that we do in the buttocks here at Student Health. And you would do that every about 11 to 13 weeks. So we would prescribe it, you would pick it up and bring it to Student Health and just see a nurse. So it's nice and easy. This method is the one that has more weight gain than other methods. And we would definitely want to talk about how you feel about that. The benefit is that it's 4 shots in a year and you're not getting pregnant. So we have to weigh those out. So those three options only have the hormone progesterone that tends to stabilize that uterine lining that you saw in the video. The patch, the pill, and the ring, those are going to be options that have different amounts of estrogen and progesterone. So those are the two hormones that people born female have in their bodies that regulate our menstrual cycle. And so the patch would be something that you would change once a week. It does have a little bit more absorption of estrogen than the other options. So about 60% more than the pill on average. And so again, something we would want to talk about in terms of what your goals are around hormones. The pill, I think, is it's the option that you have to work the hardest for, but it also has the most options available. So there are like higher doses if your period is really heavy, if it's really crampy, if it's irregular, and those are things you want changed if you're anemic, and so it's not necessarily safe for you to be bleeding as much as you are. And then there's super low hormone options that are not going to regulate you. They might even cause you to not bleed because there's not the hormone drop off that would cause menstrual bleeding. And then there's also a progesterone only pill options that we'll talk about, I think, a little bit later. And then lastly, there's the ring. The ring is something that suctions around the cervix. There's a few ways to insert it. You can insert it using your finger or using a tampon applicator. And it stays in for 3 weeks traditionally. You remove it, and then you have a week of bleeding. Now, there is enough hormone in here for 4 weeks, so there is always the option. If you forget to take it out right away, you're still protected. If you want to skip your menstrual cycle, you can leave it in for 4 weeks, take it out, and pop another one behind it. So that method, definitely more flexibility, but you really have to be comfortable with that part of your body.
Very interesting. So I guess next I'll go on to emergency contraception. I know that you've mentioned that Student Health Services offers emergency contraception. Can you tell us more about how it works and then when someone might need it and who can access it?
Yeah, so we do offer it here. Students might need emergency contraception, also known as ECP or Plan B, after a birth control slip up, say you forget to take a pill, or a night where protection wasn't used, or any situation where you just want to feel more in control of your reproductive health. It's not meant for regular use, but it's a powerful option to have when you need it. So as previously mentioned, we do offer Plan B at the dispensary in our lobby for $8 or less, making it affordable and accessible to everyone. Anyone can get it, no prescriptions needed. You don't have to be a certain age or a certain gender. And yes, it's completely confidential. We respect your privacy and your right to make decisions about your body.
And that means that men can pick it up for their partner as well. So the option that we have at the dispensary, and most people are getting over the counter, is Plan B. This works before fertilization has occurred by delaying or stopping ovulation. So that's when that egg is getting ready to be fertilized. It's maturing. So we know that Plan B usually prevents about 79 to 84% of expected pregnancies when taken within 72 hours. It's definitely more effective the sooner to the unprotected sex as possible, with some efficacy up to 120 hours. So we will give it up to 5 days after. But there is another option that's a little bit more effective than Plan B. It's called Ella. It also works by delaying ovulation. But the difference is that even if fertilization has occurred, it is still effective. And there's a lot of pathophysiology that goes into that. But it is something that needs a prescription. Sometimes it needs a prior auth as it's more expensive. The good news, though, if you're talking to a provider, and even if you don't need it, you're interested in that option, we can always prescribe it, do the prior auth, and it's good for a year. That emergency contraception is as good on the 5th day as it is on the 1st, and it has a pregnancy rate of only 1.2 to 1.8%. The only issue with Ella is that you can't take it if you're on a birth control method. You have to be off of that for 5 days after Ella, or it can impact how effective it is. So if you come into student health, we will talk you through how that all works and come up with a solid plan.
Good to know. I did not know about Ellis. That's very interesting to hear.
Yeah, Ella's great. It's just a bummer that insurance can be a pain. But we can work with that.
Awesome. That's good to know. Next one, sorry. I know birth control can be a part of gender affirming care as well. Can you talk about how some birth control methods may help affirm somebody's gender identity?
Yeah, so creating an inclusive environment, especially when it comes to gender affirming care, isn't just about policies or services. It's about making sure every patient feels seen, respected, and safe here. We also know that navigating healthcare can be especially vulnerable for trans and non-binary folks, and we're committed to listening and learning and showing up with compassion. Whether someone's seeking hormone therapy, asking questions, or they're just like exploring their options, we want them to know, that you belong here and your health matters.
And on the provider side, so that really speaks to student health as a whole. It's really important in our mission to serve this population, especially when there are resources that are being lost in our communities. And so we want to be kind of a safe haven and fill some of those gaps. So at Student Health, we do offer testosterone and estrogen. This might be someone who is starting these hormones for the first time. It might be someone restarting because they lost access, or someone who just is like, hey, this is easier for me than seeing the provider who is currently prescribing my hormones, whether that's cost or just literally we're on campus. We also do surgery support letters. So we can always chat about that. If there's something that a student is looking for, we don't have it at Student Health or Temple in general. We will find the appropriate resources as we are connected to resources around Philadelphia. In terms of pregnancy, and fertility, that is a big part about being on hormone therapy. So we talk about fertility before someone would start, as it is impacted. But people that are on hormones, it's not that they are infertile. It just might influence that fertility. But it's still important to talk about preventing pregnancy. And when we do that, we do talk about, is there sperm? Are there the parts, present with the partners to be able to allow pregnancy to occur? And what contraception option feels good if there is that pregnancy risk? And all contraception options are available for people who are on hormone therapy. So if you're on testosterone, all options are there. We just want to figure out what is right for you based on the side effects and your goals around bleeding.
Okay. Good to know. It's hard to know what to believe when seeing information on social media or on other digital platforms. And I'm worried that the preconceived notions I have about sexual health might not be the most informed. How do I process information I'm seeing online to make an informed decision?
Yeah, I think this has been a hot topic in the US for sure, definitely within student health, as we do find that anytime we're having a contraception discussion or just a fertility discussion, that we are up against a lot of misinformation. And part of this, I really think, is just that social media and information is just instantly at your tips. And so the information is instant, it's unfiltered, it isn't fact checked. And so it can be really hard to make sure that, medical providers and our support staff are seen as people who are evidence-based, and we really focus on studies to be able to guide our patients. There was an NPR article recently, a few weeks ago, that talked on this topic, and they looked at TikTok videos about contraception. This was a study that was done, and they found that only 10% of the content was created by medical professionals. And then overall, even the ones with the by the medical professionals were like not reliable and of poor quality. When I'm having these conversations with students, I want to ground myself and the patient in the fact that birth control, hormonal birth control, has been around for over 60 years. So it was FDA approved in 1960. It blew my mind. I had to like double check that. I thought it was the 70s, so I was wrong. And it has been one of the most studied in terms of safety records in modern medicine. It is something that, like, decade after decade, we're always going back to it. And I think part of that is our culture of misogyny. And so I think that it's always important to have that context when we're having these discussions. I think the other thing when I think about safety is like really looking at statistics. So getting objective data to kind of balance out all that subjective data that I'm getting from social media, from my friends, from my mom. And long-term research from the UK found that women whoever used oral contraception, so they didn't have to be actively on it, had a 12% lower overall death rate compared with those who never used it. And I think that goes into the fact about the risk to one's body when they're pregnant. So if we look at the risk of dying from a pregnancy-related cause in the US, that is 20 times higher than the risk associated with oral birth control use. And so I think we really need to weigh both of the things equally and not just focus on the risk of hormonal birth control, but the whole picture, because what we're doing is preventing pregnancy. And so we have to look at the risk of being pregnant as well. And then I guess the last thing I would just say is that, you know, you never know who is, you know, what someone's medical history is, what their menstrual cycle is like, what their preferences are, and that everyone is different. And so while it's tempting to Google or look at social media, it's also important to really go and chat with your healthcare provider, prepare questions that you have, make sure that you're getting the answers. It's on medical providers as well to inform. And it's really on you to make informed decisions about your health above all else. And yeah.
Very important. Can you also talk about the importance of self-advocacy when communicating with a provider about options?
And I had Amber do this. As a provider, I might not be the right person.
So, you know, self-advocacy means knowing your body, asking questions, writing them down before you show up so that you're prepared, and just making sure that your voice is heard in the room so that you feel like you're getting the care that you need. You're shaping your own care. It helps you become more comfortable with just even speaking up with a provider. And, you know, that kind of confidence and control is a super powerful part of taking care of yourself.
And I would just say too, is that you don't have to make a decision when you're in that appointment.
Mm.
It can be just you're gathering information, and then you're going to get resources, and you're going to go and do additional digging on your own. And also just like, what is your gut telling you?
Yeah.
Like, what are you comfortable with now? Not when your life is all together, you have a routine, your stress is low. Those don't really happen all together.
Yeah.
So just knowing too that you can always say not right now, and do your own research and come back when you're feeling comfortable.
Very good to know. Of course, self-advocacy goes beyond communicating with health providers, can you tell us about the importance of communicating with a sexual partner or partners about birth control?
Yeah, so, communicating your needs is a key part of self-advocacy, and it can certainly be intimidating, especially if you're, in a moment with a partner. But it's important to make sure everyone's involved and informed and is, above all else, respectful and on the same page, consensual. These conversations help build trust. They set clear expectations and support shared responsibility in your decision. So when you speak up about your needs and boundaries, you're not just protecting your health, you're really reinforcing that your choices matter and that you deserve respect equally with your partner.
Yeah, very good to know. Are there any other resources that you would suggest for students who want to learn more about their sexual health, whether it's on campus, in the community, or reputable online sources?
Yeah, I mean, obviously us here at Student Health. But no, I think a lot of the information I use to have these conversations with students are from Bedsider, Reproductive Health Access Project, which is a wonderful organization as well, and is where we get a lot of our education handouts. We also would definitely recommend Tuttleman. They have a wonderful, team downstairs as well. If there's any concern for sexual assault, I would also say they have their own team dedicated to that. We can always do the medical piece, but we do work together in terms of coming at it from all angles. And I would say, what else? WAR is wonderful.
I was gonna say the WRC is wonderful.
Oh yeah, you guys at the WRC.
Us. Yeah. Yeah. For anybody who's listening who doesn't know, we at the WRC offer resources, wellness consultations that can be specifically about sexual health, and then also some forms of of safer sex supplies like condoms, internal condoms, and dental dams, which are a way to prevent STIs when having oral sex. So those are all products you can pick up with your TUID for free every month. You can get up to 20 safer sex supplies from us. And then that, as well as like the other resources, information. Obviously, if you need medical care, we will redirect you to student health services. But you can always come to us and we can help connect you with those other resources.
Awesome. And then Kate, we have a surprise.
Oh, I love surprises.
Some Mythbusters.
We do some Mythbusters.
Ooh.
If you're okay, this was one of our director of nursing had this idea to focus on the top myths of about hormonal birth control specifically. If you guys are okay with us doing, there's just 5 of them.
That's some myths. Yeah.
With our glittery. Do you want me to go? Do you want to go up?
Sure, yeah. All right. So our first one is hormonal birth control causes significant weight gain.
True or false?
I'm
False.
gonna say false.
Yay! I'll let you answer next time. So most hormonal birth control does not cause weight gain. The one that we know is significant, I mentioned before, and that's Depo-Provera. And that can be about 5 to 10 pounds, but it is weight that kind of continues as long as you're on it. So it might be more if you are someone who's on that option for a few years. But all the other options, there's small weight gain that we're aware of, but it might just be typical weight gain with getting older, and like different factors that are unrelated to the birth control. So
And just to clarify, that's the one with the significant weight gain. That's the birth control shot, correct?
yes, thank
Okay.
you. Kate. Yes, perfect.
So our second question is a true or false. Okay, I'll show it there for briefly.
So true or false, if someone consents to sex with a condom and you secretly remove it or refuse to wear one, it's still consensual.
What do we think? What do we
That
think?
is false.
That is false. So it's actually a breach of consent and may legally be considered sexual assault. So respect your partner's decisions, respect their body, and respect your own body by being able to just say, no, this is not okay. We're not doing this right now.
Absolutely. And I think that goes back into how important those conversations are with the sexual partner before you have sex to find out what are they comfortable with, what are you comfortable with, make sure everyone's on the same page.
Absolutely, for sure. The next one we have, which we get a lot, it's another myth buster. You can see that birth control pills cause cancer.
This is actually one of my favorite ones that people bring up because I can actually be like, no, it's the opposite. So we actually know that it does not increase overall cancer risk. And we actually looked this up to have a statistic. But people who use the pill have a 30 to 50% lower risk of ovarian and endometrial cancers. And that protection can last for up to 30 years, even if you stop its use. And so part of that is that less shedding of that uterine lining and finding that's actually cancer preventative. So, and also you don't have to have your menstrual cycle every month. That is also not going to put you at risk for cancer either. It might decrease your risk. So
Learn something new every day. That is so
I know, it's
Yeah.
one of my favorites. Okay. This one we get a lot as well, especially with our world. So emergency contraception causes abortion.
All right, so the answer is incorrect, false. It prevents pregnancy before it starts. It doesn't end one. So that's why you have to take it within, a 3 to 5 day span.
Okay, our last one, as we get glitter all over.
All right, yeah, it's everywhere. So this is another myth buster. Hormonal birth control leads to long-term infertility.
I think this one is a huge one on social media. What do you think, Kate?
false.
Yes, it is false. So all hormonal birth control is doing, and we're really talking about estrogen and progesterone, is it temporarily prevents ovulation. If you are on a progesterone only option, this may happen, but it also thickens the cervical mucus. So the sperm can't swim through and get to the fallopian tubes that it needs. So once you stop the method, you are going to be able to become fertile. The only option where it can be delayed is the Depo-Provera, the shot. It can be delayed up to 18 months, but there still is no data that it will not return.
I know I've seen also, this is something I've seen on social media a couple times, that if you use the birth control to skip your period, that can lead to infertility. Is that also, that's a myth, correct?
Correct. I love that. I did not know that that was out there, but yes, that is a myth. So so the birth control works the same way. I think that being able to skip your period is safe. And like I said, it actually might reduce your risk specifically for endometrial cancer because of less shedding. And so I find that that's one of the benefits that I encourage people to explore. And we can always chat about how to do that safely.
It's very good to know. Yeah, and I think that again, all of these myths that we're busting, going back to that 60 years since it's been FDA approved and research has been ongoing about birth control. So all of this information is so well informed and so thoroughly researched. And obviously we're learning new things about birth control and the reproductive cycle every year, but these foundations are very concrete. You can trust and rely on this information.
I love that, Kate. That's such a good summary.
Yes. And I want to speak to, the different resources. It can be as a student, I know it can feel uncomfortable to have these conversations with adults or with peers or anything like that. But they're very important to be having. And starting with sexual health or, any of the other resources on campus, there are people that you can trust and that have these conversations every day. So it, might feel a little bit intimidating at first, but they're really safe spaces. I've had conversations with sexual health, with the Wellness Resource Center, with a whole bunch of different resources on campus, and it's always been very helpful and empowering. So I definitely, recommend that you do that. If you don't feel comfortable having those in-person conversations, those online resources that we were talking about earlier are also really important. Bedsider has a really cool feature where you can compare different kinds of birth control. So if you're not sure what you might want to start and you want to gain more information that way, you can pull up and compare, one method to another, and that's really helpful as well as these resources having, so much information about other aspects of sexual health too. So yeah, I think that kind of summarizes it up. Do you guys have any other final closing thoughts before I do a little outro blurb?
Well, no, thank you for having us, and thank you guys for watching. And please know that we are here for you whenever you need us.
Yeah, and we really appreciate it. Again, Temple students, these are resources that are afforded to us because we pay our tuition. So, use them if you need them, if you are interested. And thank you so much to you guys for joining us in this important conversation. We hope that students leave this discussion with some new knowledge and ideas about sexual health and birth control and feel comfortable advocating for themselves. If you or a friend need support, please reach out. We're always happy to assist in students' wellness. The WRC office is located on the second floor of the Student Center, right above the food court. And Sexual Health Services is located on the 4th floor of 1700 North Broad Street, which is right on Broad Street where the Wendy's is. And you can follow the WRC on social media at BeWellTU on all platforms. And with that, be well to you, and thank you for joining us today.
Thank you.
Thank you.
Bye.
Thank you.